We'll discuss the structures forming these intercostal spaces, intercostal nerves, vessels, all those we will discuss. Okay? এই সামনেগুলো বন্ধ করো তো lights. Okay, so first we will discuss the structure of the thoracic wall. Okay, you will also see dissection of the intercostal spaces. So the thoracic wall is covered by skin with nipples and areola, and in the superficial fascia with mammary glands. And there is also deep fascia which is ill-defined. Deep fascia is ill-defined because the thoracic wall needs expansion. During the expansion of the lung, and deep fascia make it tough for expansion. That's why it is absent here almost, okay? And muscles are intrinsic muscles and extrinsic muscles. See here, these are the two ribs. In between the two ribs, there are three muscles. Outermost is the external intercostal, inside it is the internal intercostal, and innermost is the innermost intercostal muscle. And you can see in between the internal intercostal and innermost intercostal lies this neurovascular bundles, the vessels and the intercostal nerve, okay? And it is giving also some collateral branches which are lying at the lower end of the space. And just inside the muscle there is a loose areolar connective tissue layer that is known as endothoracic fascia, and inside it will be the parietal pleura, then the visceral pleura, and in between these two pleura there will be the pleural cavity, okay? And inside the visceral pleura will be the lung. This pink shaded area is the lung, okay? And understood? So all these are structures forming the thoracic wall, okay? It's a schematic presentation. You practice a schematic diagram like this for intercostal spaces. It is also important for your theory, okay? Intercostal nerve, intercostal vessels comes in your theory. And the muscles you have to identify for your OSP practical question. And sometimes they also come as a part of the long question like this. So this is one rib, another rib. Outermost is external intercostal. Inside it will be the internal intercostal, innermost intercostal. And these are the neurovascular bundle. Here it is showing the posterior intercostal vessels and nerve, and these are the collateral branches. And inside it, the green one is the endothoracic fascia, and innermost is the parietal pleura. Okay, understood? So intercostal spaces, the gap between the ribs is called the intercostal space, and there are 11 pairs of intercostal spaces in between the 12 ribs, okay, of which only 9 pairs extend anteriorly. In the lower part they are open anteriorly. In between the 11 and 12th, 10th and 11th, they are open. So intercostal spaces are filled with intercostal muscles and the membranes. The 3rd to 6th intercostal spaces are typical intercostal spaces because of the blood vessels and nerves supplying these spaces are confined only to the thoracic wall. They does not supply upper limb or abdomen, okay? So contents of the typical intercostal space. There are muscles, you have seen already. Muscles are external intercostal, internal intercostal, and intercostal is intimus or innermost intercostal. Intercostal nerves are there, this is nerve. Posterior, anterior intercostal arteries, these are the arteries. Intercostal veins, and structure lying at the costal groove. This depression is known as costal groove. Here the structures vein, artery and nerve lying from above downward, vein structure. You remember the mnemonic VAN, from above downward. Vein, artery and nerve. And we will see this in the dissection also in this following manner. Then intercostal veins, lymphatic vessels and some lymph nodes are also present. So intrinsic muscles of the thoracic wall, it is formed by intercostal muscles and some other muscles. Intercostal muscles are 3 in number: external intercostal, internal intercostal. Intercostal is innermost intercostal. And other muscles are subcostalis, sternocostalis or transverse thoracis, levator costorum, serratus posterior superior and inferior. So all these are intrinsic muscles of the thoracic wall. So now we will discuss the intercostal muscles in details. Okay, we will discuss origin, insertion, nerve supply of all these three muscles. So intercostal muscles are arranged in three seats from outside inward. Outermost is the external intercostal, middle layer is internal intercostal, and innermost is the innermost intercostal or intercostalis intimus. See here, external intercostal and its fiber direction is important. Fiber direction has been shown. Fiber direction is downward, forward and medially, like this. Like you are putting your finger inside the pocket, downward, forward and medially. Okay, this is the finger direction of fibers of the external intercostal. And for internal intercostal, it will be at a right angle to the external intercostal. That's why the fiber directions are important for identifying the muscle. So what is the origin of the external intercostal? Origin is lower border of the rib and insertion is outer lip of the upper border of the rib. So this pink colored one is the external intercostal and it continues anteriorly as the anterior intercostal membrane from this costochondral junction up to the sternum. Okay, and direction of fibers are downward, forward and medially. So external intercostal is the outermost intercostal muscle. Another name is intercostalis externi. It are 11 pairs in number. Extend is external intercostal muscle extends from tubercle of rib. Here lies the tubercle of rib. Tubercle of rib to the costochondral junction. This is junction between the rib and the costal cartilage. So this is costochondral junction. This is the extent from posterior to anterior. And anterior intercostal membrane, what is this? This is asked in your viva. Between the costochondral junction and sternum, external intercostal muscle is replaced by anterior or external intercostal membrane. Okay, understood? So it is modification of external intercostal muscle, anterior intercostal membrane. Another is posterior intercostal membrane, that is modification of the internal intercostal. Okay, so that you have to know for your MCQ and viva also. So external intercostal muscle origin is from lower border of rib above the intercostal space, insertion into outer lip of the upper border of the rib below the intercostal space. Direction of fiber in anterior part of intercostal space, fibers are directed downward, forward and medially. Okay, and intercostal nerve of the corresponding space is giving nerve supply to this muscle. Action is also important. Mechanism of respiration comes in your long question, okay, from thorax. Mechanism of respiration, and for this mechanism all these intercostal muscles are important. And this fiber direction is important for identification of the muscle during dissection. Okay, so action is elevation of the rib in inspiration. So external intercostal helps in inspiration. Rest of the two muscle, internal intercostal and intercostalis intimus, they help in expiration. Okay. Next we are going to internal intercostal. See the fiber direction. Fiber direction is downward, backward and laterally. Okay, just at right angle to the external intercostal. So and see this continuation of fibers, they are continuing here posteriorly as the posterior intercostal membrane. Okay, so origin is from the floor of the costal groove, insertion into inner lip of the upper border of the rib below. Okay, so internal intercostal forms the middle layer of intercostal muscles. It is also 11 pairs in number. Another name is intercostalis interni. Extend is from the lateral border of the sternum to the posterior angle of the rib. At this reason is called posterior angle of the rib. Okay. Some of you have done in the histology class ribs class have been done? Okay, so you know the different parts of the rib. Okay. So extent is from lateral border of the sternum to the posterior angle of the sternum, and posterior intercostal membrane beyond the angle of the rib, the internal intercostal muscle becomes continuous with the posterior or internal intercostal membrane. Okay, so origin of this internal intercostal or arises from floor of the costal groove of the rib above the intercostal space, insertion into the inner lip of the upper border of the rib below the intercostal space. Direction of fiber in the anterior part of intercostal space, fibers of muscles are directed downward, backward and laterally. Fiber direction important for identification. It lies at right angle to the fibers of external intercostal muscle. Innervation is by intercostal nerve of corresponding intercostal space. Action is it helps in depression and retraction of the rib during the expiration. Okay, so this muscle is for expiration. Next, we are going to innermost intercostal. Okay, it is present only in the middle to fourth. Anteriorly, it is absent. Posteriorly, it is also absent. And fibrous direction is same as the internal intercostal, downward, backward, and laterally. Origin is from the middle to fourth of the ridge above the costal groove. Insertion into the inner surface of the rib. So innermost intercostal muscle, it forms the innermost layer of the intercostal muscles. Another name is intercostalis intimus. It is also 11 pairs in number. Extent, it occupies the middle to fourth of the intercostal space. Origin is from the middle to fourth of the ridge above the costal groove. Insertion into the inner surface of the rib below the intercostal space. Direction of fiber is similar to the fibers of internal intercostal muscles. Okay, so 3 intercostal muscle we have discussed. And nerve supply is by corresponding intercostal nerve. Action is along with internal intercostal, helps in depression of rib and expiration. It is also helps in expiration. And neurovascular bundles run between the internal and innermost intercostal muscles in the neurovascular plane. And innermost intercostal muscle is absent in the upper 2 to 3 space. Okay, this is important for Viva and MCQ where they are absent. And the muscle is internally separated from the pleura by a thin layer of endothoracic fascia. Okay. According to previous concept, innermost intercostal muscle has 3 parts. Intercostalis intimus, transversus thoracis and subcostalis. But according to 41st Gray, innermost intercostal, subcostalis and transversus thoracis are separate muscles. See, this is the subcostalis muscle. Okay, these muscle fibers you will see during posterior wall of thorax dissection. So, subcostalis muscle origin is from the inner surface of the rib near its angle. This is angle of the rib, here it is taking origin, and insertion into inner surface of the second to third rib below. Okay, it is crossing one rib and then getting inserted, you can see. So subcostalis lie in the same plane of innermost intercostal muscle, variable in number. It is well developed only in the lower part of the thorax, and origin is from the inner surface of the rib near its angle and insertion into the inner surface of second or third rib below. Okay, and direction of fiber is similar to the innermost intercostal muscle. Innervation is adjacent intercostal nerves. Action is depresses the ribs. Next, we are going to transversus thoracis. On the right side, it have been shown. These are the transversus thoracis. It lies just behind the sternum and the anterior thoracic wall. Another name is triangularis sterna. It almost forming a triangle. Origin is from the sternum, insertion into the ribs. Okay. Origin is from lower 1/3 of body of sternum, Gifford process, costal cartilages of lower 3 to 4 true ribs, and insertion is into the inner surface of second to sixth costal cartilages. Okay. transversus thoracis. So sternocostalis or transversus thoracis number a pair of 4 to 5 radiating sleeves are there. Origin arises from posterior surface of lower 1/3 of body of sternum, xiphoid process, costal cartilages of lower 3 to 4 true ribs. Insertion is into the inner surface of 2nd to 6th costal cartilages. Direction of fibers, fibers diverge upward and laterally. Innervation is by adjacent intercostal nerves. Actions, it pulls the 2nd to 6th costal cartilages downward. Okay, this is the function. Okay, so we have discussed all the muscles, intrinsic muscles of the thoracic wall. Next, we are going to intercostal nerve. Okay, so each intercostal space is occupied by intercostal muscles, intercostal vessels, and intercostal nerves. And ventral primary rami of first 11 thoracic spinal nerves, they are forming the intercostal nerves. 12th thoracic nerve from the subcostal nerve. Okay, sub means below and costa means rib. It lies at the below the rib cage. Okay, and it has segmental distribution. The intercostal nerves have segmental distribution. See here, this is the spinal cord. Spinal cord lies within the spinal canal. So from here, the intercostal nerve is arising. It is dividing into dorsal rami and ventral rami. Ventral rami is continuing as the intercostal nerve. It is giving lateral cutaneous branch, anterior cutaneous branch, muscular branches, all these. Okay. And it has a communication. See here, this has a communication with the sympathetic ganglion via the grey rami communicantis and white rami communicantis. And grey rami communicantis contains the postganglionic fiber and white rami communicantis contain the preganglionic fibers. Okay. So according to distribution, intercostal nerves are classified as typical intercostal nerves and atypical intercostal nerves. Typical intercostal nerves are confined to thoracic wall and 3rd to 6th intercostal nerves are typical intercostal nerves. Atypical intercostal nerves, in addition to thoracic wall, they supply additional structures. Okay, this is asked which are the atypical intercostal nerve and where they supply. Okay, so you have to know this for your viva and MCQ during the bones viva, ribs viva. Okay. So first intercostal nerve from the lower trunk of the brachial plexus. Okay. C5 to C8 and T1 you have read. T1 is taking part in formation of brachial plexus. T2, second intercostal nerve. It gives lateral cutaneous branch called the intercostobrachial nerve, which supplies the skin of the floor of the axilla and upper part of the medial side of the arm. And 7th to 11th intercostal nerve, they supply the anterior abdominal wall along with the intercostal spaces. So these are the atypical intercostal nerve and rest of the nerves are the typical intercostal nerve, 3rd to 6th. Okay. So intercostal nerves has a ventral primary rami of first to 11th spinal nerves. There are typical intercostal nerves, atypical intercostal nerves. Typical intercostal nerves are confined to chest wall. Examples are 3rd to 6th nerves. Atypical intercostal nerves, they supply additional structures. Examples are 1st, 2nd and 7th to 11th. We have already discussed. So, what is the course of a typical intercostal nerve? They are confined to the space and 3rd to 6th are the typical intercostal nerve. They, up to the costal groove, they lies behind the sympathetic trunk between the costal pleura and posterior intercostal membrane. In the costal groove, they lies between the internal intercostal and innermost intercostal muscle, and relation is vein, artery and then nerve. Lowermost is the nerve. These are the branches of typical intercostal nerve. Rami communicantis, grey and white rami communicantis. We have discussed muscular branches for the intercostal muscles. One collateral branch is there passing through the lower part of the intercostal space. Lateral cutaneous branch and anterior cutaneous branch, they are piercing through the intercostal muscles and intercostal membrane and supplying the skin of the thorax. Okay, segmental distribution. And these are some clinical aspects we will discuss in details. So typical intercostal nerves are confined to the intercostal spaces only. Examples are third to sixth intercostal nerves. Here direction of fibers and location of the nerve have been seen. See external intercostal, downward, forward and medially. And internal intercostals, downward, backward and laterally. Okay. Innermost is same fiber direction, and in between internal intercostal and innermost intercostal lies the neurovascular bundle. And this neurovascular bundle is lying in the costal groove, see at the lower part of the rib, and structural relation is vein, artery and nerve, vein from above downward. And these are the collateral branches from this vein structure. Nerve is collateral branch from the intercostal nerve, and artery and veins are also branch from this artery and veins of the intercostal space. Okay. So these are smaller branches. And here is endothoracic fascia, parietal pleura, visceral pleura and lung. You have already seen. So what is the course and relations? In the costal groove, here is the costal groove of the rib. In the costal groove, the nerve runs between the internal intercostal, innermost intercostal muscle in the form of neurovascular bundle. And relations in the neurovascular bundle from above downward is posterior intercostal vein, posterior intercostal artery and intercostal nerve vein structure. And anteriorly, the nerve pierces the internal intercostal muscle and anterior intercostal membrane, and pectoralis major muscle to continue as the anterior cutaneous nerve. Okay, you have seen this whole picture. See here, this is the lateral cutaneous branch. Here is the anterior cutaneous branch, where it is piercing the muscle, supplying the muscle and then piercing the muscle to become cutaneous supply of the thorax, thoracic wall. Okay. A diagram like this you practice, okay, for intercostal nerve. Intercostal nerve can come as a long question for theory, okay. So it is the ventral rami of the intercostal of the spinal nerve and giving muscular branches, cutaneous branches. Cutaneous branches are piercing through the muscle here. Lateral cutaneous branch divides into anterior, posterior branches. And here it is joining with the dorsal rami, cutaneous branch of dorsal rami, and anteriorly it is piercing through the internal intercostal muscle and anterior intercostal membrane and becoming cutaneous as the anterior cutaneous nerve, which is again divided into medial and lateral branches and supplying the skin of the thorax. Okay, understood? Same thing have been shown. Here it is connected to the sympathetic ganglion. This is dorsal rami, ventral rami, giving muscular branches, lateral cutaneous branches, anterior cutaneous branch dividing into medial lateral branch, and here anterior and posterior branch. Okay. And this posterior part of supply of skin coming from the dorsal rami. So branches are connect the nerve with the sympathetic chain via preganglionic fibers through the white communicants, postganglionic fibers which are unmyelinated passing through gray rami communicants. Muscular branches for intercostal muscles and serratus posterior superior, and collateral branch arises near the angle of the rib and it passes forward along the upper border of the rib, supplies the parietal pleura, intercostal muscles and the periosteum of the ribs. Okay. So this is the branches of intercostal nerve. Lateral cutaneous nerve divide into anterior posterior branches, supply skin on the lateral thoracic wall. Anterior cutaneous branch emerges on the side of the sternum, divides into medial and lateral branches, supplies the skin of the front of the thoracic wall. Okay. Next we are going to peculiarities of first intercostal nerve. It is a atypical intercostal nerve. contribution to the brachial plexus. It forms the lower trunk of the brachial plexus by joining with the C8 nerve, and it runs under the first rib due to the absence of the costal groove in the first rib. Okay. So no collateral branch and anterior cutaneous branch is present for first intercostal nerve. So these are the peculiarities of first intercostal nerve. This is one clinical aspect, thoracocentesis. Thoracocentesis is done from the lower part of the intercostal space to prevent injury to the neurovascular bundle, which is lying along the upper part of the intercostal space in the costal groove. Okay, so this is one explain why question. Why needle is pushed through the lower part of the intercostal space during the thoracocentesis. Okay, thoracocentesis is done to take out fluid from the pleural cavity. Okay, in case of pleural effusion, chylothorax, hydrothorax, pneumothorax, like. So understood why it is done? To prevent injury to the neurovascular bundle. If these are injured, there will be paralysis of the muscle, the difficulty in respiration will occur, and if injury to the vessels occur, there will be heavy bleeding. Okay. Okay, so thoracocentesis is done in the 8th or 9th intercostal space in the mid-axillary line along the upper border of the rib to prevent injury to the intercostal nerve. And herpes zoster is another clinical aspect. It is the viral infection and may spread to the skin supplied by the same cutaneous nerve and produces vesicular blister. Okay, this is segmental distribution. One nerve is involved, the distribution area of that nerve, in that area only you will see the blisters, and pain will occur in the supplying area of the nerve only. Okay. See here, the blisters or single herpes zoster blisters confined to a specific intercostal space. And here you are seeing the dorsal root, ventral root, dorsal root, spinal nerve have been shown, and virus spread through the sensory root of spinal nerve. The posterior root is the sensory root, so virus spreads through this sensory root of the spinal nerve. Next, in the next class, we will discuss the vessels, okay, intercostal arteries and veins. Those are also important long questions for theory. Okay, up till then, you have any queries? So you read the intercostal muscles, origin, insertion, fiber direction, all, and prepare the intercostal nerve as a long question. Understood? And the clinical aspects are also comes as a part of long question. Those thoracocentesis or herpes zoster, all these are important. Okay, understood? Okay, any queries from this topic? No queries? Okay, that's all. Thank you.